Abdominal organs in the right quadrant. Epigastric esophagus, peptic ulcer, perforated ulcer, pancreatitis, liver, stomach, spleen, duodenum, adrenal glands, pancreas. Right hypochondriac, gallstones, cholangitis, hepatitis, liver abscess, cardiac causes, lung causes. Liver, right kidney, gallbladder, large small intestines. Right lumbar, ureteric colic, pyelonephritis. Right lumbar region, ascending colon, small intestine and right kidney. Right iliac, appendicitis, Crohn's disease, second obstructions, ovarian cyst, ectopic pregnancy, hernias. Appendix, second ascending colon, small intestines. Hypogastric, testicular torsion, urinary retention, cystitis, placental abruptions, bladder, sigmoid colon, small intestines, and the reproductive organs. Left hypochondriac, spleen abscess, acute splenomegaly, spleen uretery. Liver steep, stomach, pancreas, left kidney, spleen, large small intestines. Umbilical, appendicitis early, mesenteric, lymphadenitis, microdiverticulitis, lymphomas. Umbilical region, duodenum, small intestines, and transverse colon. Left lumbar, ureteric colic, pyelonephritis. Descending colon, small intestine, and left kidney. Left iliac, diverticulitis, ulcerative colitis, constipations, ovarian cyst, hernias. Sigmoid colon, descending colon, and small intestines. Auscultation of heart valves needs to be in the exact aortic, second ICS at the R sternal border, tricuspid, fourth ICS at L sternal border, pulmonic, second ICS at the L sternal border, mitral, fifth ICS in the mid-clavicular line. This is the apical pulse. Onde of face, temporal movement towards outside of ear, carotid, side of neck, brachial, inner side of biceps, radial, inner wrist underline of lumbar, femoral near pelvic bone, popliteal behind knee, posterior tibial, lower thigh, dorsalis pedis over the instep of the foot. Yes. How to guess on boards. Order of answer questions. 1. Use knowledge. 2. Use common sense. 3. Use a guessing strategy. Use these strategies when you don't know what's going on. In psych questions, 1. Nurse will examine his or her own feelings about. This is the best because you need to be self-aware so that you do not counter-transfer your feelings. 2. Establish a trusting relationship. If you pick something else, you would be saying that it isn't important to have a trusting relationship. But don't use this as an example where safety is more important. For instance, a patient with schizophrenia has a knife and is about to stab you. Do establish a trusting relationship or run away? Run away. Nutrition. 1. In a tie, pick chicken except if it's fried. If chicken is not there, then pick fish, but not if it's shellfish because this is a high cholesterol. 2. Never pick casseroles, tuna, chicken, etc. for children because they won't eat it. 3. Never mix medications and children's foods before you ever do so. With any patients, you need permission. For toddlers, finger foods, it's not about nutrition content, it's about what they can eat. 5. Preschoolers, leave them alone. They eat when they are hungry. They do not need the foods the toddler needs because they don't have a growth curve unlike toddlers and infants. One meal a day is okay. Example: you can take a bite out of everything your plate, but you don't have to finish the meal. Pharmacology. 1. Most test area is side effects. Don't memorize dosage roles frequencies. Memorize side effects because you are a nurse and your job is to assess for side effects and to see if drugs are working. 2. If you know what a drug does but you don't know the side effects, how do you proceed? Pick a side effect in the same body system where the drug is working. Example: you knew the drug was a GI drug, but you didn't know the side effects. Would you choose drowsiness, tachycardia, or diarrhea? Diarrhea. If it was a heart drug, choose tachycardia. If it was a CNS drug, choose drowsiness. 3. If you have no idea what the drug is, look to see if it's PO. If it is, pick a GI side effect. 50% chance. 4. Never tell a child that medicine is candy. This is dangerous because the children could eat medicine at home, think that is a candy. Do you know what the drug does? Yes. Do you know what is the side effects? Yes or no? OB. OB. AC of the spades. Check fetal heart rate. Always. Med surge. One first thing to assess. Luck. A example: ACLS is in a code. Hey, what's your name? That's the first thing you do with is assess loc. LOC. 2. What is the first thing that you do? Establish an array. Pediatrics growth and development principle. Always give the child more time to grow and develop. 1. When in adult, call it normal. 2. When in adult, pick the older age. Of the two, you are stuck now. 3. When you adopt, pick the easier task. General guessing rules. 1. Rule out absolutes. There are some absolutes you should know. Never give potassium IV. Never give a medication without identifying a patient. 2. Two answers that are saying the same thing cannot be correct. For instance, increased vowel sounds and barbarisms, they are both incorrect. 3. If two answers are opposites, one of them is probably right. 4. The umbrella strategy, which answer is more global. You want to say all of the above, but it's not an option. An answer that covers all the other without saying it does. An answer that is so broad that when you do it, you do all the others. Example: when you transfer a patient from the bed to the wheelchair, what is important? A. Bring the chair as close as possible to the bed. B. Remove the foot pedal so you don't trip over it. C. Use safety and good body mechanics when transferring. D. Lead into the bed with the strong foot. If the question gives you four right answers and asks you to choose the top priority, if your patients use four roles, but if they give you one patient and which of the following needs is the highest priority, you take each option and ask yourself, if I did not do this, what is the worst thing that could happen? Example: which of the following is the highest priority when caring for a suicidal patient? A. If you do not give him a tranquilizer, agitations. B. If you do not orient him to the unit, get lost and go. C. If you do not put him on a suicide precautions, death. D. If you don't introduce him to staff, wouldn't know anybody. 6. The Sesame Street rule: you last resort. Three of the things belong with the others. One of these things don't. Right answers tends to be different than the others because it's correct. The wrong answers are all similar because they share something in common, that they are all wrong. 7. Don't be tempted to answer a question based on your ignorance instead of your knowledge. If you don't know what something is, put it off of the question and answer it. Use common sense. Don't freak out and it's when it's hard. This happens in the first 10 questions. Example: what is important to parents of a child being discharged on a pain suspensions? Take out pancakes. Shake before administering. 8. If something seems right, it probably is. Do not change your gut answer unless you can prove that another answer is superior. Go with your gut unless you can articulate another answer is superior. 3. Expectations you are not allowed to have. 1. Don't expect 75 questions. Today it's 85 questions. Expect 145 questions, not 265 questions. Prepare yourself to go for the maximum. This is a computer that to test. It would have shut off if you were failing. You are still in the game. 2. Don't expect to know everything. Don't expect everything to go right.